Are you excited?
Yeah, I am very excited.
Justin Trudeau's first shot. His wife Sophie got hers too. She didn't need her hand held. Getting the AstraZeneca vaccine is a shot in the arm for the government's tagline that the best vaccine is the one you can get, undermined an hour later by the country's National Advisory Committee on Immunization.
NACI recommends that the AstraZeneca COVID-19 vaccine may be offered to individuals 30 years of age and older without contraindications if the individual does not wish to wait for an mRNA vaccine and the benefits outweigh the risk.
Yet again, changing advice from NACI, acknowledging some people want to wait, and they seem to suggest with good reason.
NACI continues to preferentially recommend authorized mRNA COVID-19 vaccines.
I don't think we should be vaccine shopping at all if we're going to get the vaccine, especially if we have an underlying medical condition.
Dr. Neil Rao says the perception AstraZeneca is an economy-class vaccine compared to first-class mRNA is unfortunate.
Having too much information sometimes can be very challenging for people to understand, and it could lead to vaccine hesitancy.
That's a speed bump on the road to normalcy. We just don't know exactly how big it is.
That large part of the population that may be sitting on the fence or maybe is a bit hesitant, you can see what the difference is.
The country's top doctors presented a new type of slide Friday, for the first time showing the conditions under which restrictions could be lifted this summer without overwhelming hospitals. 20% of Canadians would need their second shot and 75% their first.
At this point, restrictive measures could be gradually eased as long as adequate test, trace, isolate capacity and individual precautions are maintained.
But the modeling shows hospitals will be overwhelmed even if that first dose coverage drops to 55% of Canadians. And of course, the other piece of the puzzle is supply. Ontario and Alberta have already said they won't give AstraZeneca to people in their 30s simply because they don't have enough. Abigail Bimman, Global News, Ottawa.